Well, welcome everybody to our first forum of the semester, and we're delighted to have Kate Wilson and Allie Hobley here today to tell us about some data they've collected.
Yes. Well, thanks for being here again. I know many of you. So I'm Katie Wilson. I work as the health educator at Student Health Service, as many of you know. And I've also taken over some responsibilities with the Center for Alcohol Studies and Education this year. So my office is now in Schofield. And this is one of my students, Allie. I'll let her introduce herself.
All right. Hi, I'm Allie Hobley. I am a senior here at the UWEC, and I work for Katie and for the Student Wellness Advocacy team. I run the Facebook and the Twitter page and the blog, along with doing the SWAT sort of presentations around campus.
Yeah, so thanks for being here. This past year, we conducted the National College Health Assessment on our campus, which is why we're here, presenting the data. And I'm on this kind of leash here, so it feels really awkward. But the National College Health Assessment is put out by the American College Health Association, which is our main college health professional body. And it's done on many campuses now. It's very widespread. It's kind of the gold standard of assessing students' health. The survey is very extensive. And it touches on a very wide variety of issues. So it looks at health in a more broad sense than the kind of health that sometimes we're accustomed to hearing about, which is just that physical health, the nutrition and exercise, sleep kind of thing. So this is, I know it's kind of blurry, I just pulled this offline. But these are the different aspects of wellness. This is the wellness wheel. And so we know that health is much more than just physical health. It includes, financial health and spiritual health and social health. And so when addressing campus health issues, when you look at it really broadly, we're all kind of doing health work on campus. Career Services is doing health. ORSP is doing health in terms of creating intellectual opportunities for students. So I think beyond the kind of typical things you think of, offices that you think of that are involved in health on campus, it's really much more broad than that. And I think that the National College Health Assessment does capture that. It's not perfect. It's been critiqued as being kind of pathologizing some things that might be normal. Stress, stressful experiences can lead to resilience. So we know that that's not necessarily a bad thing. So you kind of have to not look at the stress statistics and go, oh my gosh, everybody's extremely stressed out on our campus. Stress is normal. It leads to resilience. But I think the thing we have to take care of is just making sure somebody's not overly stressed where it leads to a bad outcome. We've had a lot of suicides on campus recently, and so that's something that we need to make sure we're supporting students in all of their experiences. So a little bit about the survey. We surveyed 3,000 students, sampled 3,000 students, got about a 21% response rate, which was 640 students, which we were really pleased about. We incentivized it with $20 Target gift cards, which apparently was just all the students needed to jump on board. And I will give a shout out to Dr. Muhlenkamp's suicide prevention grant. She provided the funds through that so that we could incentivize it. We figured if we're going to do it, we might as well try to get a really good response rate. So this is kind of the breakdown, as you can see, of the different groups. There were also questions that were asked on, are you an international student? Do you have a disability? What's your sport involvement? GPA, Greek status, relationship status? Are you a transfer student? What's your weight and height and your age and year in school? And so those are, I think those create some really interesting opportunities for data analysis because you can correlate GPA and sport involvement, or GPA and sleep, GPA and alcohol use. There's no measure in the NCHA for kind of how happy are you, and I think that would be kind of an interesting thing to correlate, GPA and happiness or something like that. So again, it's more on the kind of pathologizing, different things and not really focusing on the positive as much. But this would be it's an exciting data set, I think, for people who are really research driven and can do a lot of that data analysis. We have the data in SPSS, so it's just there to be kind of mined for all that good stuff. And the sign-up sheet, I will send you all the the information we have. It's kind of a free-for-all. The only caveat is that if you use any of the information and you run some analyses on them, I'd really love to see that information because we don't have enough time to do all those analyses that we'd like to do. So we'll just start by getting into the data. We're just going to give an overview. Again, the assessment is extensive. It takes like about 30 minutes, I think, for a student to complete it. So this is not by any means all of the data that we have, but this is just kind of a summary. One of the interesting questions that it asks is about academic impact. And we have to take this a little bit with a grain of salt because this is a reported academic impact. So did you receive a lower grade on a test or project or in the course? Was there a disruption in your thesis? Did you get an incomplete or have to drop the course related to all these different health behaviors? So we listed the top 5 and then number 12 because that's, I think, significant. Stress, which was just defined very broadly, just stress. So whatever a student thought was stress. So that's kind of a little problematic. Anxiety, sleep, cold, flu, sore throat, work. And then alcohol is number 12, but I thought it's important to put that up there because alcohol could lead to sore throat or it could lead to sleep disruption that leads to none of us can tease out how our health behaviors all affect one another. And so this is self-reported. And I think students are probably less likely to report that their alcohol use negatively impacts their health because maybe they don't want it to and they don't want to admit that to themselves. So the self-report, I think, is really key. But there were all sorts of other measures on here. Let me just look at in here. Concern for a troubled friend or family member, depression, participation in extracurricular activities. The list just goes on. So again, kind of taking that with a grain of salt, but it is interesting to see what the perception is of the academic impacts.
Were those the students had many choices, or they
many
wrote in?
Many choices, and they're even an other, I think. So we couldn't list them all out here, but again, if you want that information, we'd be happy to send it. And if anybody has questions, I'm glad Karen asked. Please feel free to go ahead and ask them. So sleep, Joe Abhold, the Dean of Students, always says if he had a magic wand to change students' health behaviors, he'd wave it and change their sleep habits and their alcohol habits, and I think I agree. Sleep is so key in health and how we function just in our daily lives. So our students really don't get enough sleep, which is probably not surprising to all of you. There are a couple questions about sleep. How often do you feel tired, dragged out, sleepy? So a lot of our students are feeling that many days of the week. So that's going to affect their whole lives. Getting enough sleep, very few students are getting enough sleep on the majority of the days. That 3 to 5 category is kind of a broad one. So perceived versus actual drug use, this is a fascinating one. Students tend to overestimate how much their peers are using drugs and alcohol. So for instance, alcohol, this is perceived use in the last 30 days. So they ask students, what do you think the typical student, how many days is the typical student using alcohol? Or, and then this is the sum of those responses. So if they reported, yes, a typical student is using alcohol, at all in the last 30 days. Perceived is 96%, actual is 72%. Cigarettes, the perceived is 68% and the actual is 9%. So only 9% of students are using cigarettes on in the last 30 days. Do you have a question? I'm seeing some talk. Oh, it's startled. Yeah, by the gap. Marijuana, 87% versus actual 16%, which 16% is actually really high and troubling. But as marijuana gets further in legalization, that's probably going to be the case. So it's troubling that people think, that peer pressure, people feel kind of pressured to be like other students. And so there is kind of a movement to do some kind of social norming where many of you are probably familiar with it, to just correct people's perceptions so that they can have that. Actually, not all students are smoking, and so don't feel pressured to smoke. I think some of these are just a very. I think people brag about them a lot, so maybe that contributes to people perceiving that they're used more. Smoking is a very visual behavior. You see the cigarette smoke fly up. You see people congregated. So you might focus in on that even though you're surrounded by people who aren't smoking. So I think that kind of contributes to it. Yeah.
You did this already, but I'm going to ask you again. To paraphrase what the question was.
Mm-hmm. So the question was...
If you don't have it, or if you have it exactly there.
On how many days do you think the typical... So the question for the video was what the actual question was. So they asked students, how often do you perceive the typical student on campus, or how often do you think the typical student on campus uses the following substances? So then there was the typical student doesn't ever use. You could check that, or used but not in the last 30 days. You think the typical student uses all 30 days. So then this is the pushing together some of those responses.
If it was perceived 96%, that they would have marked, they perceived one student?
No. So I say, okay, how often do I think a student uses alcohol? I would say, I think the typical student uses alcohol on 1 to 9 days per month. Okay, so that's tabulated there.
Okay.
So we collapsed some of the information. So people think that almost everybody is using alcohol in any given month, that the typical student is using alcohol. But I can see where your confusion is, but I don't want to dwell too much on it. I can talk with you afterwards.
I understand it better seeing the raw data.
Okay, great. So again, interesting policy implications, I think, with this, like the tobacco policy on campus, because people think that if we went tobacco-free, we might disenfranchise all these smokers, because 86% or 68% of people are smoking. In reality, we're not, it's not as big a deal as people think. And it would create a healthy environment for all people, in my opinion, as a health educator. So binge drinking, as defined as 5 or more drinks in a sitting within the last 2 weeks. So this is 2 weeks, not 30 days. This is the breakdown. So we're seeing a lot of people who are not drinking or who didn't binge drink in the last 2 weeks, about 57%. So that's a good thing. We broke down the males and females differently because there was such a big difference in the 3 to 5 times category. So men are binge drinking at a higher rate than the women are. So we have a lot to get through still. So I'm going to turn it over here to Allie, who is going to talk about the next slides.
So looking at contraception and STI prevention, we looked at how many students reported using a condom or another protective barrier in the last 30 days. And so this is looking at not things like hormonal birth control or an IUD, something along that line, but a barrier method, so a condom or a dental dam. So in regards to oral sex, no males reported using any sort of barrier method, where 2% of females reported using it. 52% of males and females, 55% in regards to vaginal sex, and 38 and 30 for anal sex. So looking at the barrier method as a form of STI prevention, there isn't a lot going on within the student body to prevent from STIs. Also for nutrition, the daily servings of fruits and vegetables within a day. The majority of students said 1 to 2 per day, and we kind of set them up. I think the daily recommendation is 9 servings of fruits and vegetables, and so we really can't measure, if someone is only having 5, they're still not meeting the daily recommendation, so a little bit of a concern there. Looking at physical activity, moderate intensity for 30 minutes in the last 7 days. 1 to 4 was kind of the typical, or the other option 2, vigorous intensity, either cardio or aerobic exercise for at least 20 minutes in the last week. And the recommendation would be either 30 minutes of moderate exercise at least 5 days a week, or the 20 minutes of vigorous exercise at least 3 days a week. And so based on that recommendation, 52% of the students who reported are meeting that expectation. So a little over half. So again, in that health standpoint, something to be concerned about. In regards to mental health within the last 12 months, if they've been diagnosed or treated by a professional for the following, and there were a lot of options, but the ones we saw the most were anxiety, 6% of males, 17% of females, depression, 7% of males and 14% of females. And it's important to note that diagnosis and treatment for anxiety and depression are the two most things that students seek help for through student health services. ADHD, 5% of males, 3% of females. Panic attacks, you can see the difference there, 2 for males, 8 for females. Sleep disorders, either insomnia or any other kind of sleep trouble, 6% of males, 5% of females. And as Katie showed in the sleep slide, students are having trouble with sleep. It's a big issue on campus, but there really isn't a lot of students seeking help for it within campus. And the majority of students reported none of the above and not seeking help in regards to mental health.
And I think just kind of going back to the differences between the males and females, I think that's pretty striking in some of those cases that females are really experiencing a lot more issues with anxiety and depression, for instance. I think it kind of gets, if you take a step back and look at society, women are marginalized. We live in a sexist societies in many ways. And I think that's reflected here a little bit. And I think it has some implications also for diversity in other ways, racial diversity, ethnic diversity, disability status. So anytime somebody is in a marginalized group, they're going to be experiencing more stress in their daily life than other people might. And when you have increased stress, then you have increased cortisol levels, and that's the stress hormone, and you're at risk for a lot of chronic diseases. So I think that's something that we don't think about diversity and stress and mental health and health always hand in hand, but it's really important, and to have people feel like they belong and that they're not marginalized is really important to somebody's health. Yeah.
I'm wondering if, because it's diagnosed or treated,
Mm-hmm.
but I wonder if men seek treatment for that less.
Mm-hmm.
That's probably true. That's probably true, and I
So,
think
I
we
mean,
probably
that'd
do
be
have
another
that.
part of the equation
Mhm.
for that one.
That's a great point. That's a great point.
And I think it's important to mention too, as Katie had said, we got financial help from Dr. Muhlenkamp and the Spark grant. And Dr. Muhlenkamp also does a lot of work with kind of combating that stigma that goes along with seeking help for mental health. I also work with her suicide prevention presentations and just encouraging people to know when things aren't okay and that it's acceptable to go and seek help through counseling services, student health services, or other resources on campus.
Yeah, that's a great point though. These are diagnosis based, so we probably are seeing greater help-seeking behavior by women. But I think that the comments still stand in terms of diversity, and that again, looking at health really broadly, the diversity fellows are doing health. The Office of Multicultural Affairs is doing health. The Dean of Students Office is doing health. It's really so broad that you can't it's not the typical, just student health service and counseling services and recreation and sport facilities and CASA and CASE. It's everybody. It's everybody's business, students' health.
So then, looking specifically at stress, the specific causes within the last 12 months, on the slide ahead of myself, within the last 12 months, how would you rate your overall stress? And the majority of students reported average stress, but close to the same amount of percentage reported more than average, and there are students who are experiencing tremendous stress. So again, this has a big implication as far as students' health, as Katie was saying, the release of cortisol and things like that. And so things that have caused this stress within the last 12 months, again, there were a lot of options for students to select, and we pulled the ones with the highest percentages. So academics was by far the highest, 40% for males, 48% for females. Career-related issues was the second highest, 22% across the board. and family problems, and you can kind of see the difference here. More of a concern for females than for males. Also, intimate relationships is a significant cause of stress. Again, a little bit more for females than males. Social issues in general, a big cause of stress. Finances, personal appearance, and again, here it's interesting the difference between the males and females. Obviously, much more of a concern for females than males, with 27 versus 19%.
And I think the finances are getting to be such a huge issue, as college debt rises, and there's a lot of stress related to finances, and people are relying on their degree to eventually make them money, and there's a lot of family pressure to make money and to get through school, and if you don't get your degree, then you're left with a burden of debt. I know within the state of Wisconsin, the debt isn't as high as typically people think. I had somebody tell me one time, "Oh, did you know the average student debt is $100,000 if you attend a UW school?" And I said, that is absolutely not true. But there is significant debt, and there's more, a lot of people are becoming more concerned about that. And we know that student engagement is good, and if you have a campus job, it's good, and if you're involved in sports and other extracurricular activities or co-curricular activities, it's good, but if you get over that hump of you're working too much for money or you're doing too many things, then that can be detrimental to your experience and your success as a student. So,
and I know, especially, I'm on the swim team, and I know especially when Katie mentioned being involved in extracurricular activities, finances can be a drawback for, I've had teammates who have had to decide not to participate because if financial aid didn't go through, they need to take on more hours. Most of my teammates do work jobs on top of being student athletes. Also, there's a lot of finances that go into if you do play sports that we're required to pay as well, and so I know that finances can be a big thing that keeps people from getting involved on campus because the job becomes a higher priority. Sleep difficulties, again, very similar. And very few reported none of the above, as there was a very long list that you can see if you get a copy of the data, but very few people reported not feeling tremendous stress for any of the things above noted. Safety, we thought, was another very important thing to highlight. On campus during the day, the majority of people felt very safe on campus, 96% across the board. However, at night, and you can see there's a very, very big difference between how men and women feel in regards to their safety on campus. At night, 77% of men compared to 40% of women. Off campus, 87% of men versus 72% of women feel safe off campus, and then a very big difference again at night. And even comparing from on campus to off campus, men feel a lot less safe when they're off campus at night. And I think that kind of shows that, at least for the control that we do have on campus, that it is making somewhat of a difference to make students feel safe. And so finally, just talking about what we're doing to improve students' health. Katie has mentioned a few. Student health services, SWAT case is kind of an obvious, but all across the board there are departments, and it's everybody's responsibility.
Yeah, definitely. I think there are a lot more resources out there than people realize sometimes, like financial aid, for instance, has a financial wellness kind of online seminar kind of thing to go through, online lesson, and that's huge, to be able to manage your money and responsibly can really lead to feeling healthier and being healthier. Career services, that's the career aspect of wellness, and we see as students get closer to graduation, they get more anxious, and that can lead to some serious, anxiety issues, and this whole, like, what am I gonna do? And I remember feeling that in college when I was gonna graduate, but it's, for me it was okay, and I got a job and everything, but we know that for some students, we need to provide that support so that the students can get through that experience. Like I said, academic departments all contribute to intellectual wellness. Office of Multicultural Affairs, in terms of students' sense of belonging and safety on campus. Women's and LGBTQ Center. So we're all contributing, I think, in some way, shape, or form to students' wellness. And I think just kind of taking a step back, again, to think about wellness broadly. When I'm talking with students, I hear a lot of times, I just really want to focus on my academics. I'm not going to really get involved. And there was even a parent one time who her student was going to be in the healthy living community on campus, which is a living learning community up in Murray Hall. And he pulled out at the last minute, the student did, and he said, well, my mom didn't want me to, she wants me to focus on my academics. And I was like, oh, that's such a shame, because it's so well-intentioned. Yeah, you would think you'd come to college and focus on your academics and do really well, and that's what you want to do. But actually, we know that increased student involvement, like I said, engagement in campus, in different areas of campus, leads to greater student success. And the healthy living community there is an academic component. You take a class with your fellow residence hall students, and so. Or I tell people, students, leave your backpack at home sometimes. Go out and have fun with your friends, because that social network is so important. If you have more social support, your health is going to be so much better than if you're just in this small bubble thinking you have to kind of go it alone. I had a student apply for the SWAT team one time, and he just had everything together, and he knew himself, and he knew how to be healthy, and he wanted to tell everybody how to be healthy, and he said, I only have time for one friend. And I said, wow, that sounds really lonely. And are you really healthy? And again, he thought about health from, I exercise, I eat right, I use protection when I have sex, and just that narrow physical focus, rather than going back to the wellness wheel of the spiritual wellness and the social wellness and the emotional wellness, and that all contributes to our health. And so I didn't hire that student, if you were wondering, because I didn't think that he would be a good role model of balance in your life. But those are just some of the things that I think about when I talk with students, and some of the stories that I hear. Do you have anything to add?
Not that I can think of.
Okay. Well, we'll open it up to questions now. We have about 10 minutes left before our time is up. We have Joe, who just joined us. Joe, I quoted your whole magic wand thing with the sleep and alcohol.
My magic wand's at home today.
Yeah, darn.
Katie, what can we do with this data? Where can we go with it?
What can we do with this data? Where can we go with it? Do you mean from a practical standpoint of how can you get the data? Or from...
No, I mean, so it's
yeah.
It's information.
Mm-hmm.
So are there some takeaways that...
Well, I think that from my perspective is we have to focus on the big issues that we can identify. It would be interesting. We did this in tandem with other UW system schools, so there could be some comparisons to see, what are our sister institutions looking like in terms of their students' health. So we could kind of say, well, that may be where the gaps are, or in the entire reference group of all the students that are surveyed with the National College Health Assessment, we could look at, are there areas where our students are really lagging? Or I know, like in alcohol use, the students are probably a little above the average, being in Wisconsin. So I think we could identify areas for improvement there. I think we have to look for some low-hanging fruit in some cases. There are programs that we know work to increase, for instance, STI prevention. Just having condoms be more available to students is one CDC recommendation for Centers for Disease Control recommendation for increasing condom use. So that's one thing. That's kind of low-hanging fruit. For some of these other things, I think we can look at our policies and our, I mentioned the tobacco policy. That would be a policy level initiative that could affect the health of a lot of students. So students who aren't smoking, it would affect the air around them. They wouldn't be inhaling secondhand smoke as much if we had a tobacco-free campus. It would. Tobacco-free policy is shown to help keep students tobacco-free as well, which is great because we don't want students to start smoking while they live on campus or go to school on campus. So those are some policy initiatives, and we're working on those. I think there are some things that we didn't touch on here, such as like bike helmet safety, that again might be kind of an easy project to get bike helmets out into the hands of students. Yeah, go ahead.
I think from a student's perspective, when you go back to that wellness wheel, I think that concept is not very well known by students, and I think there are a lot of resources that Katie said that are available to students on campus that are going to help with the overall wheel of wellness, and they're definitely being utilized, but at the same time I think I know a lot of peers who don't use them, and I think just increasing the awareness and increasing the use of things like career services, counseling services, the academic resource center. And so when we look at these issues of stress, I'm stressed about finances, I'm stressed about what's, work, or what am I going to do when I graduate, and encouraging wellness in the sense of not just I'm going to go to student health services because I have a cold, or I'm going to wear a condom when I have sex to protect myself, but I'm going to make sure that I'm being responsible with my money. I'm going to make sure that my mental health is good, those sort of things.
And I think it's a cultural thing as well. So I don't have the answer exactly about this, but I think we as a faculty and staff, we don't necessarily model what it means to be balanced, or what it means to to turn off your phone and not be checking your work email all night.
Yeah, I was hoping Joe would wave his sleep wand over me.
Yeah, exactly. I mean, we all struggle with our health, and we're never all going to be perfect. But there are things we can do. We can structure the campus and help to be healthier. I'm on the bike and pedestrian committee, and we're looking at ways to make everybody safer on campus, make it easier to bike on campus, but also keep pedestrians safe so that they're not, bikes aren't whizzing around Central Campus during passing period. So there are some collaborative efforts across campus that are working on those sorts of things.
I could see a really fun informational campaign with that data about the difference between actual substance use and perceived substance use.
Definitely.
I could see some really fun ways of letting the students know that.
Yeah, and that is a movement called the social norming movement, and to try to correct students' perceptions. One interesting thing is, we talked about this recently with CASE and SWAT, is that DARE, you're probably familiar with the DARE program from many years ago, and we have to always make sure that we know what the unintended consequences of a program is, because that actually ended up social norming, like you're all gonna, everybody's gonna try to make you do drugs, and everybody's doing it, and you're just gonna have to be really strong and say no. And they found that in some cases that made people think that, it made them perceive that there was actually more that was going on. And I think there was like a gang one too that I went through when I was a kid. So it's interesting how we have to just be careful about how we do our work. But so I think there's a lot of work going on. I think it's hard to sometimes capture all the different things that are going on. But I think we're working collaboratively. We have more student wellness folks that are meeting together on campus, that are having more collaborative relationships. Joe has done a lot to bring people together around campus from different wellness kind of focused units. So I think that's been good. But we just kind of continue to plug on and try to identify those really big issues. The tobacco-free campus issue, I think, is one of my goals, because it is a policy level change we could make that would affect everybody on campus, and I thought it would be exciting to me to clean up the air on campus. Laura, you had a question?
For all of us, the next step in measuring not only what we're doing, but what are some of the resilient factors that students have already, and how can we build upon them? So that's what we're not seeing, unfortunately.
Right.
In this data is, yes, we're seeing a lot of students that are stressed and overwhelmed, and many of us maybe are saying the same thing, but what are they doing about it? What are the healthy, positive behaviors they're doing to counteract that?
Right.
I don't know if the next step, as I see it, is figuring those out and measuring what we can do to help students build upon those skills to counteract that.
And one of the theories in student development is challenge and support, right? You challenge them, and whether it's in class or in any area, you challenge them, but then you also support them. So I think, like I said before, stress sometimes leads to resilience, and you can it's developmentally appropriate for people to be stressed out about relationships at some point in college, and that actually leads to greater learning as long as you can get through it and you're not, at the point where you're so stressed out and so overwhelmed by it that you take your own life, or you have to drop out of school because you're so overwhelmed. So I think it is hard. You have to take some of this and say, well, that's normal, and it's normal to be stressed out in life, and not all stress is bad stress. Anything that we encounter in life is stress in one way or another. So again, it's that kind of pathologizing of stress. And if you looked at this data and you might kind of freak out and say, everybody's stressed, but it's okay sometimes to be stressed. We're putting expectations on students that they've never experienced before in terms of, how they do their classwork, how much they're studying. They're with a lot of peers, and so there are a lot of social things going on. So it's not always bad stress.
So how do we get this data out to people where they can do more in-depth analysis of some of these?
Yeah, that's a great.
issues? That would be.
Yeah, if anybody has ideas, this is a collaborative effort. Definitely. Any other comments or questions?
I was just going to ask you, did you say some people had asked you about using the data?
Yes, the question was whether people have asked about using the data, and we're open. We're going to share it as much as possible. I think it would be great to have people analyze the data, to run those correlations between GPA and sleep and feelings of safety on campus, and all those things that could be really interesting. I think especially from a climate. I know we have the campus climate survey, but and I'm not sure if we have enough of a sampling of students of color that we could make useful correlations. But I think those are some of the things that aren't captured in just this data that I have, but it could be with the SPSS raw data. So we're willing to share, and again, other people collaborated on this effort. Jennifer Muhlenkamp provided some of the funds from her grant, so we don't feel like we own the data in any way, shape, or form. But I want people to tell me when they do those analyses so that I can use that as well. Yeah. Joe, you had a question?
Same question.
Okay. Great. So tell all your colleagues.
When's the last time you did the same survey? Does it change substantially, or can you use like 3 years ago or whenever the last data set was and compare?
We did it 3 or 4 years ago. We did it very differently at that point. Pardon?
2008 and 2012.
Yeah, that sounds right. 2008 and 2012. Well, we'd like to get this either on a yearly or every 2-year cycle, I think is our goal.
Nice to be able, if you could compare it over time to see trends, but if it's not the same survey, I guess
Yeah.
you can't.
I recently looked at some of the marijuana information for Joe because he requested that, and we are seeing an increase in marijuana use. That's been in the papers lately. Over the years, I looked at the 2008 data. Some of the questions change a little, so it's not apples to apples always, but a lot of the stuff does stay the same. It doesn't ask about religion at all, which is interesting because that spiritual wellness. So that's, I think, something that's missing. That's just something I just remembered right now.
And it is going to be a big of a change, but the next version of the NCHA is going to be 3. This was NCHA 2, right?
Oh, okay.
So
That sounds right.
asking for
Yeah.
input right now.
Yeah, so they're constantly updating it, and that is some of the critique that I've been hearing on the College Health listserv is this is really pathologizing all these experiences, and how do we get at, are these leading to good outcomes or not, and that that happiness question. Nobody's asking like, are you fairly happy here? Are you having a good experience? And I think that's an important question.
Well, I like Laura's idea of asking students what helps them, so that you would know what they think is useful or perceived as useful.
Yeah.
So we know the negative things that impact them, but what's going to do the most good?
Where do they find support?
Yeah.
Yeah, I think we can find some of that in college development theory or in just our own professional area of expertise in counseling. I would hope that Lynn would know what helps students in counseling as the director of counseling services here. But yeah, I think it'd be interesting to see what students think would help them. There were questions about what information would you like from your college to be provided to you from your college. But that's, again, you know, it's self-reported and it's just the information aspect. It's not what would, you know, help you and help you be more resilient. So it's kind of more narrowly focused, I think, than we're talking about. Well, thank you very much for coming. If you have questions, we'll stay afterwards. Thanks.